This is Dr. Cathy Pratt, and I'm the director of the Indiana Resource Center for Autism. I'm a board certified behavior analyst. I have a doctoral level of that. I was first trained in ABA by Lovas in the 70s. And so I have a long history of doing ABA. I think that through the years, I've become a BCBA that really takes a much more positive behavior support approach. And I really believe in ABA. And oftentimes in consults, I will recommend that a child attend an ABA program. With that said, it's not for everybody. And with that said, we also know that ABA is becoming a business across our country. And so my goal with this presentation is to actually talk to you about what you should be looking for as you investigate ABA providers. On our website, we have a list of ABA providers that from all over the state of Indiana. We don't go outside the state of Indiana. And this article was written by people who come from the Ball State program, from the Purdue program, from family members, and from BCBAs who have clinical programs. So what you're going to see is really kind of a document that was really built on consensus. So what exactly is applied behavior analysis? And I think, you know, it's an interesting question. And when I get together with groups, and we for years have had an ABA task force, one of the first questions that I will ask people is, what is ABA? And right away, they say it's a 40 hours a week program. But you need to know that for 40 hours a week is not appropriate for all kids. And it actually is not research-based. It's more of like 25 hours a week. So, but what you have to understand, and if this is confusing to you, is that we have applied behavior analysis, which includes a whole host of strategies like positive reinforcement, shaping, chaining, discrete trial teaching, and that can occur in any setting. And in truth, we use ABA with each other, not in a clinical fashion, but we really do use applied behavior analysis principles. So what many ABA centers and programs do is called early intensive intervention, which includes one-on-one systematic and data-driven instruction with the goal of not only decreasing problematic behaviors, but then also teaching alternative skills. So always when you get rid of a behavior, you always focus on what is it that we're going to teach instead. So if your child, you have a meeting about your child and they say, we want to get rid of your child's hitting, your question should be is, what is the replacement behavior that we're going to give my son or daughter? Because if we don't come up with a replacement behavior, what will happen is that the child will replace it, and it may be worse than what they started out with. So there's kind of two levels of staff that are involved in it. One is the board certified behavior analyst, the behavior analyst, the BACBs. And BACBs technically are only supposed to oversee 6 to 12 clients. I know that in some of the programs across the state, especially as many more companies come in who work across multiple states, that many of them will have ABA, one BCBA who is working across the state. So for example, I had a company approach me about being put on my list. And they have about 13 different clinics in the state of Indiana, and they're in Illinois and Michigan too. And when I looked at their website, there's only 2 BCBAs on staff. And so I pushed them and I just said, you know, the standard is that there should be only 6 to 12 clients that each of your BCBAs serve. If you want to know more about the board, about what's expected from BCBAs, I included a website. So we all have to respond to the Behavior Analyst Certification Board. So when you become a BCBA, you go through 15 hours of coursework. There's so many hours of supervision, field work, and then you have to pass a test. And to become an RBT, and the RBT, if you kind of make a parallel comparison with schools, the RBT are kind of like your classroom aides. So the RBTs also have to have some training as well, and they have to be, there has to be oversight from the BCBA. So again, these are credentialed professionals who don't necessarily have a lot of experience with kids with autism, but who have gone through this semi-rigorous training as well. So what we know is that professional development has to be part of regular ongoing. So I am expected every year and I provide ABA credits, but I'm also expected to not only go through training and have professional development units for those being a trainer, but then I also have to go through so many credits every year, so that just like with teachers who are expected to have get credits by going to conferences, we see that people who are board certified behavior analysts have to go through training on a regular and ongoing basis. And it's a little expensive, and we have to sign off on it, and we have to show that we actually did have that training. So Indiana, and please, I'm not saying this to sound negative, but I'm really very concerned about protecting consumers. And so Indiana, a few years ago, a group of us were able to get a licensing bill. Many states in our country have licensing bills around for BCBAs. We do have a licensing bill that was passed, but it has not been finalized. It's not been operationalized, so it's not in practice yet. So I tell people that in order to start an ABA clinic in the state of Indiana, it is harder to become a bartender in Indiana than it is to start an ABA clinic. There really is no oversight provided. And so our goal in having a licensing bill is that when families contact us and with concerns about the treatment that their child's getting, that there would be a road that they could take to kind of figure out how to improve services. Some of our ABA providers have gone through something that's called Behavioral Health Center of Excellence accreditation. So on the list of ABA providers, we actually list those who have gone through this accreditation. It is a very extensive accreditation, and you can get accreditation for 1 year to 3 years, but it really does require people to come in and look at all the paperwork of a center, and also as well look at the practices that are done. So trust your gut instinct on some things. You know, in the early days of Lovaas, just to kind of put a historical perspective on it, Ivar Lovaas actually used electric shock. He had a punishment and reinforcement process. And so if kids were acting out, he would use electric shock. And what they would do is that they would have like metal strips connected to kids' arms. And I actually, one of the times that I met Lovaas, actually, he used the electric shock on me just so I could feel what it felt like. And it wasn't so lovely. And he came to the realization that kids became immune to the electric shock. And so he really turned his practice towards more positive approaches. But to this day, what I see is that some ABA programs still use pretty restrictive practices. And those are really discouraged. And a lot of that is because of the negative side effects that they have. And so many people are calling for the use primarily of positive reinforcement. That's what should primarily be used. So the other thing is that when there are behavior plans, like I am involved with 2 ABA centers and I'm on their human subjects or human rights boards. So when they have behavior approaches, behavior plans that are punitive or that include anything that could be construed as negative, they have to run those plans by me. So what you want to know is what is the approval process that your plans go through to make sure, especially if they have restrictive interventions, so you know that they're being overseen and that they're not being used as the go-to. And, you know, I could tell you horror stories. Overall, many of our ABA programs use positive approaches. But if you see a BCBA or an RBT using a practice that you feel uncomfortable with, question it. It shouldn't be getting used. And it's interesting, right now, there's a lot of controversy amongst people on the autism spectrum about ABA. Some of them like it and feel like it really helped them. But some of them talk about that they felt that it was really like dog training and that it was, that they have some trauma from it. So, you know, is there an external review board? How are you informed of the behavior plan? Have you seen that behavior plan? Is it something that can be carried out in the home as well? And, you know, what policies are in place for preventing abuse? Because we have had some abuse in some of our programs. So, you know, what are the practices that are in place? Because again, remember that there's no oversight provided to these programs at all. And do they have policies in place? And you should ask to see the center's policies or the provider's policies as well. So ABA should always include data collection, and the data is collected for the purposes of making program decisions. I think ABA does a really nice job overall. As a science, they do a really nice job of data collection. It's one of the hallmarks of ABA is that there should be data collection. But the providers and centers should be able to provide you with data on a regular basis that is in an understandable format so that you know what's actually going on with your child. Sometimes the data for me even looks like mumbo jumbo. And so, if don't hesitate to question, if you're handed reams of data, you should ask the question, how does this, what does this mean for my child? So the question is, how does your center assess if progress is being made? And can you see examples of how this is being done? And then once your child is in a program, it would ideally be lovely if you could have regularly scheduled meetings with your child's BCBA or supervising provider to review progress, to provide updates to the program, and provide you with the skills to help and maintain and generalize what your child has learned in the home. Lovas took a lot of his programming into home settings. And, I can argue back and forth about that because he didn't see the generalization that when kids were in a center, that those skills were not generalized to the home situation. But if you do home ABA, there has to be something set up so that it's set up like a small clinical program. And I know some families and homes just can't do that. So they should have rules and explain a schedule for observation. If you notice that, and again, that an RBT or a BCBA interacts in any way that makes you feel comfortable, stop the process. And I've visited ABA programs before where I have stopped them in what they were doing because I felt really uncomfortable with it. There's been restraints. And you should ask for more information about why that process is being used and understand the potential harm and the potential good for it. So, your child is precious. And you need to know that they are in safe hands. And so most of the centers and programs should have background checks. They don't always, and if you hire frontline staff to come into your home, there should be some way that you do a background check on them as well. The provider that you're using should be doing a background check so that you know exactly anything that you need to know about that individual. So, again, people have believed that every child should receive ABA for 40 hours a week. And there's a lot of different kinds of versions of ABA. A friend of mine talks about, kind of full-time ABA. And then as they get older, for example, her daughter is in her 20s. And so they are using ABA to help her with some specific things like going to the dentist and going to doctors. So not every child is going to need 40 hours a week, as I mentioned earlier. And the rule of thumb is 25 hours a week is what the research really says. For some kids, 40 hours could be helpful. And I know that gives parents a break as well. So, but if individuals are being transitioned, and this is one of the things that you have to be careful of, is that we see kids who are transitioned out of programs very quickly. And so there should be a transition plan to move the child out of therapy and into more natural settings. So one of the cautionary notes that I would tell you is in school settings, and this isn't an either or about either school versus ABA. I think that they both have their benefits and they both have their challenges. But I think one of the things that school does a really nice job at is when your child reaches 14, they acknowledge the fact that you have to really start looking at transition planning. So one of the things that I would ask parents out there that they not do is I've seen kids who are kept in ABA programs up into their 20s. And then I look at calls from parents and say, my child has been in ABA for 15 years. And now he's 25 years old and sitting at home and I don't know what to do with him. Through the school process, there is something called transition planning where we start moving individuals into adult services. And honestly, if you don't at that time get them into the system, it oftentimes is harder to find options for your son or daughter. So I really encourage you to make sure that you don't lose focus on getting your child into transition planning. So how quickly your child transitions out is going to depend on a number of issues. And I'll talk about the transition a little bit more in a few minutes, but it's really going to be based on your child's needs and the supports available and the program that's available in the school setting. I think, whatever program that you do with your child, whether it's in a school program or it's an ABA program, I think you have to be very clear about what the goals are for your child. What is it that you hope to achieve? An ABA provider will do an evaluation, which is either the VB map or ABLES or something, and they will come up with some goals. But I think that you as a family should also talk about what the goals are for your son and daughter, what would help make your family more cohesive, and so, go into those meetings with ideas, if it's communication, if it's toilet training, if it's that social skills, if it's behavior goals that you have, whatever it is, to be very clear about what you want to see happen for your sons and daughters. And, I think, although ABA providers have hold many core beliefs in common, you will find a lot of different philosophies about things. For example, some ABA providers do not believe in sensory. I think they've come away since then. I think I've noticed progress, but I remember even 5 years ago, ABA providers said there's not research behind sensory, and so we don't acknowledge sensory as a challenge for kids. Having been in this field for over 40 years, I will tell you that there's many children with autism who need sensory programming. So when ABA providers would say to me, I don't believe in sensory programming, and I could see a kid who was clearly having sensory issues, who was clearly pushing their chin on things, who was clearly rocking, then that was really not depriving that child of what they needed. I think the other thing is that we have to also understand that oftentimes there are medical conditions that are contributing to the behavior as well. So for example, I was in an ABA clinic with a kid who I'd known for a long time, and he was doing really well. And then all of a sudden his behavior tanked. And, the response of some of the BCBAs there were, we have to do another behavioral assessment and create another behavior plan. And I noticed that he had bruising on his chin, and looked in his mouth, and he had rotted teeth. So you always want to assess, is there something medically going on with individuals? And don't make assumptions about what is really bothering the child. And then some ABA providers believe in the use of visual supports. Some don't, or augmentative communication systems. Again, having been in the field of autism for so many years, I know that that visual supports benefit all of us, and definitely do benefit children on the autism spectrum. And again, I see an evolution where more of our ABA programs are embracing the use of visual supports. I also look to see if there's a speech therapist or occupational therapist. If they're not on staff, are they kind of consulting with the staff so that the staff is able to look at the child? Or do they see your child, or do they just see the behaviors that have to be changed? What do they know about your child? And I think the difficulty, and one of the things that I've heard from adults is that sometimes when people are dealing with behavior, all they see is the behavior and they don't see children instead. Oops. So again, be prepared to make a list of skills that you and your family want your child to do. In the plan developed for your child, skills should be taught that are valued. One of the things that ABA says is that the skills should be socially significant. So they should be things that are really important for kids to do. So again, communication, toilet training. I think eating at a table is really important, playing with brothers and sisters or cousins, and thinking about skills that you want them to engage in now and in the future. And, understanding your child's preferences and what they love to do, and, so that they can communicate their desires as well. So how much will it cost? Just so that you understand, school districts get around $9,000 to $11,000 a year for a child. ABA programs get anywhere from $60,000 to $90,000 per child. And so that's one of the main reasons that they can do so many different things with your sons and daughters, because they get paid at such a higher rate. But we do see that costs vary greatly, and there are no standard fees. So you want to find out what the cost is. And you also want to find out what payment options they take. So Medicaid is common. Indiana was the first state to have an insurance mandate. And so private insurance is available. Right now, I understand that Medicaid is paying at a higher rate. And Children's Special Health Care Services, we were able to get them to provide up to $10,000 per child. There is an article on the Indiana Resource Center for Autism website that talks about the funding options that are available. So if you have questions about that, go to our website or email me if you need to find out. But, ask what the co-pays are going to be, the co-insurance, the deductibles. And, also check with other families to make sure good and ethical business practices are being followed. Not all of them follow good and ethical business practices, and to find out the costs that are charged by various centers or providers as well. So some of the other things that I just want you to think about. So in order to receive ABA services, your child has to have a medical diagnosis. And in the law, there is a strong leaning towards the use of ADOS. But your medical doctor or a psychologist will have to do an assessment to determine if your son or daughter meets the criteria for an autism spectrum diagnosis. When your child goes to the school programming, the schools have to do their own evaluation to see if your child meets educational eligibility and under what label they meet that educational program or what diagnosis. And so families oftentimes get confused because they'll take their medical diagnosis to schools, and the schools will used to say, no, we don't want to accept that. Now they will say, we'll look at that and we'll take that on, but we still have to do our own assessment to determine what label your child will be served under. I think the other thing that I want you to understand about discrete trial teaching and some of the strategies that are used in ABA. So discrete trial teaching is we give a child a cue, point to the letter A, the child does it right, and then we reinforce them. So that's the antecedent, the behavior, and the consequence. That's discrete trial teaching. And then we take a break, we pause, and then we do it again. And that kind of skill drill is one of the most common practices that is used in ABA programs. And one of the reasons that it's so successful with our kids is because rote memorization, rote learning is one of their strong skills. These kids can rote memorize many things. I had the honor of having Temple Grandin stay with me in August. We've been friends for decades. And as bright as she is, as successful as she is, she still has difficulty with comprehension. And so rote memorization, rote learning is really her strength. I have a grandson who is 4 years old, and when I went to see him, his mom was showing me how he could point to the letter A. Well, she had these flashcards that she used, and she only used these flashcards. So when I pointed to an A on the board, he didn't know what it was. So I think one of the things is do not mistake true understanding with rote memorization. There should be some programming towards comprehension. We also see that sometimes children are asked to leave ABA programs. And some of the reasons that I see are that the behavior is too intense, is that funding has ended, or that the child has met their goals. And sometimes that transition process is really quickly. And so the schools will then be scrounging around to provide programming for your sons and daughters, when all of a sudden, and I've been involved in a lot of these transition processes with kids who have just shown up, and especially through the pandemic, kids went to ABA programs because school programs were closed. And so, but now they're just dropped off in the school. And so you have to understand the reason, and there should be transition planning. I have a colleague who does a really nice job of transition planning. So when kids go back to the school setting, she sends a notebook with data and a notebook that has explanations of strategies they've used and some information about the child. So the child is just not dropped off at the doorstep. I talked about the privatization. So ABA has become a business. I am approached all the time from businesses. I was just approached by a company that wants me to promote the privatization of ABA programs. I have a dear colleague in California who ran a very successful card ABA program. She sold her business to a company, and she is really lamenting the fact that the quality of the programming has really gone down. So we still do have some companies that are owned by people in the state of Indiana. And I would try to find out, is this company part of a larger corporation? And that doesn't mean that they're necessarily bad, but there's been a lot written about how the quality has gone down as they're a privatization. Now, with that said, here's what I'm going to say. There are waiting lists to get into ABA programs. So I wouldn't care if it was privatization or not, but I think just to be aware of that, if I really wanted my child in an ABA program, I probably wouldn't care whether it was private or not, but just know that if you have a choice, look to see, where the ABA program is rooted. I think the other thing is, that sometimes ABA programs give us empty promises, and I think, when ABA first came back around, because ABA was really predominant in the 70s and 80s, and then kind of went out of fashion for a while, and then came back in the 90s and the, 2000, 2010. And at that time, parents were promised, if you have your child in this ABA program for 3 years, they're going to be cured of autism. And, I know that individuals will improve, hopefully. But I think that you have to be very careful. People who make grandiose promises, I think in my mind, are just really, I've used the term, are seducing you with hope. And, so, look to see what really is happening with them and to see what their qualities are, and ask for, a little bit of background about their rates, their success rates, and, what they see has worked with kids. And then again, we have a list of ABA providers, and in that list, we listed according to city, we list the name of the ABA provider, we list the contact information, and we've gotten kind of more particular about this, because I will go back and I will call some of the ABA providers, and if I can't get hold of them, then I know that it's going to be very difficult for you all to get hold of them. So if you cannot get hold of an ABA provider on our list, please reach out to us, and I probably will ask them some questions about why it's so hard to get hold of them. Thank you all. We're here for you. If you need anything, just